Okay, it's Dr. Buford here. We're just getting started on the right knee. We've already harvested some bone marrow and made a nice kind of stem cell injection for you to use at the end. We can see you've got some meniscal fraying on the inner edge, but nothing that appears to be unstable. I'm turning on the suction to see if that meniscus is unstable or not. You can see you probably had an old injury that looks like it healed, so that's good news. We can put some of our stem cell injection right there to try and make that even better. As far as the articular surface, the medial condyle, medial femoral condyle up at the top of the screen looks pretty good. There's our first loose body. Now we'll go ahead and put in a grasper, see if we can grab it. Sometimes we have to get a little tricky here. Okay, so we got one. We'll continue our little hunt here. Don't see anything else right there. We'll look in the central part of the knee. This is where you had the old surgery. And that looks good. You can see the tunnel in the tibia there, and it's got reasonable tension on it. Again, you're not having any instability, so no reason to do anything to that. We're here more because of the loose body. So next we'll go off on the video. We'll look in the lateral compartment. Okay, so here you've got a little bit more of a meniscal fraying on the lateral meniscus here, and a little bit more of a loss of cartilage on the femoral condyle up above and on the tibial plateau down below as you look down below here. So far, no additional loose bodies have been seen. Hold that, please. Table down, please. Take that. Bend the knee a little bit, just a little bit. A little more. Great. Okay, so here's a pretty good look at this lateral compartment shaver. And I don't see anything else really to worry about here other than what we've already talked about. You can make sure that meniscus is stable. Just making sure there's nothing loose here. And that all looks pretty good. So, yeah, I mean, obviously you have more arthritis than I'd like to see in someone your age being so young, but we have to play the cards we're dealt, and we've got some tricks and options to help minimize symptoms from this type of arthritis that you're showing here. Just making sure there's nothing loose way in the back here. So far, nothing. Okay, good. So far, the one loose piece has been in that medial compartment. We'll look in the patellofemoral compartment in a little bit. Drop this. Just pull, just pull. Okay, so we're looking in the medial gutter here, because sometimes loose pieces hang out here. We can put our shaver down here. We can even turn on a little bit of suction. And I think we got the one loose piece that was there earlier. Now we're going to come back up here. We can show you, you've got a lot of arthritis in this patellofemoral joint. Look at this. See how rough that is? And so, again, that's why we're doing our bone marrow concentrate procedure, to try and slow down this progression and minimize your symptoms. Sorry. But this is likely where these loose pieces are being generated from, all through here. Okay, so now we're going to look up here. We'll look down this lateral gutter. Nothing loose down there. Okay, so if there's anything else to show you, we'll come back up on the video, but I think for the most part we're done with the loose body removal and identifying exactly how much arthritis you've got. You basically got grade 4 arthritis in the patellofemoral joint, and I would say probably grade 3 in the lateral compartment, grade 2 in the medial compartment. Okay, so hopefully this does the trick for you. Now, good luck to you. Bye-bye.